My name is Ross DeVol, and I'm Executive Director of Economic Research at the Milken Institute. My guest today is Paul Kusserow. He's the Chief Strategy and Corporate Development Officer for Humana Incorporated. Paul, if I could you tell us a little bit about what deals have you done?
Well, we bought a company for about $800 million called Concentra. We closed this deal in December. This is the largest workers' comp occupational health company and worksite company for employers. It also has urgent care centers, and they provide other types of care. What we liked about Concentra was they have 1,100 health professionals. About 550 of them are doctors. We're providing alternative site care. We believe this is important because we believe when members go to the hospital, sometimes it's unnecessary. That creates incredible cost and a lot of complication as a result.
Paul, if we could, let's dive just a bit deeper into the aging population. What are some of the trends that you're seeing in terms of statistics, perhaps, that you could share with our audience that would really highlight why this is such a critical market?
Yeah, well, the world population is one, it's going to grow. In the next 50 years, it's going to increase by 2 billion. Actually, the population under 5 is going to decrease in the next 40 years by about 50 million, but the people over 60 are going to increase by 1.2 billion. So the whole idea is longevity is what's affecting our demographics.
I mean, every problem presents an opportunity.
Right.
The figures you've cited can be seen as being quite staggering. Will healthcare reform really address the needs of this rapidly growing population, or do you have concerns?
I have concerns about healthcare reform. I think healthcare reform did a lot of very good things. One, it increased the access for people who previously couldn't get insurance or couldn't get care. So I think so we have a whole new population that are fundamentally going to be coming in. The key question is the costs. So do we have enough providers out there that fundamentally, or is the demand going to be such that people are going to increase the prices, and this is going to become a real problem and a circular problem in terms of, increased demand equals increased cost. So I think the idea is we have to start to look at other things that are fundamentally going to allow us to keep the costs down and for us to be more efficient. Those efficiency drivers, I think, are technology combined with services. Telemedicine in particular, I think, is going to be very important, using sensors, having individuals stay out of hospitals because there's early warning type tools, particularly with the chronically ill. There's a high portion of people in Medicare who have chronic disease. Having electronic medical records where that data is accessible so that care providers can see that immediately rather than having to retest and constantly figure it out. That's going to be an area. Caregiving is going to be an area. Finding lower cost people to give care. Medication management is going to be another issue. A lot of times health costs are increased because people aren't taking their meds. And then I think there's going to be a whole social community reach here using social structures and networks that fundamentally are going to, group around people so they can mutually stay on top of the care issues of these various members. It's going to be a very interesting migration in terms of people thinking about, how do we take care of a much older generation with chronic disease issues.
There's been a lot of concern. We're adding 30 to 40 million people to the healthcare rolls today. What can we do in terms of health extenders, using nurses more effectively in some of those roles in the healthcare system to kind of alleviate the problems of an insufficient supply of doctors?
That's a great question. There won't be enough doctors. So be very clear. There currently aren't enough doctors now. There's a 10% of the population doesn't get enough access to physicians. It's going to, by 2020, it'll be 20% of the population. That'll mean for us we'll have to find 130,000 doctors by 2020 to satisfy the demand. That's highly problematic. So we're going to have to start to turn to nurses and other alternative care providers. It's just important. How do we do that? We have to leverage the doctors better, and then the doctors have to know when they can hand off to the nurses in a much better way. Nurses can provide a lot of the care, particularly nurse practitioners, and I think we have to really empower them and have teams of health providers with doctors potentially leading them, and then handing those off to what we call extenders, techs, nurses, people to fill in some of the gaps there.
One of the issues that we've examined at the Milken Institute is the rising rate of chronic disease. We did a study called An Unhealthy America, the Economic Burden of chronic disease, and it's really helped shape some of the public policy decisions, especially in the area of preventive care. Really, what is Humana doing to move into this prevention space, especially as it pertains to lifestyle choices and perhaps behavioral modifications?
Well, if you look at how our business is structured, where most of our costs are, frankly, with those people that are most sick. So about 85% of our costs are actually allocated towards about 15% of our population. And the rest of that population, fundamentally, it would fall into a well bucket. And so the key is how do we, so it's very important for us to engage people who are well, who are currently well, and to start to build some of that engagement. And so we have programs with the Vitality company that we bought in South Africa to create integrated wellness programs. So for our commercial members in particular, we will, this is a program they will get, and they will be part of a wellness program. This will give them information about what their current health status is, what they need to do to actually improve it, what their, how it'll improve their age if they do that, and then it will give them a very good reward system. So we believe that a combination of rewards, awareness, health literacy, that's what our play is in terms of wellness, and that's what we believe will really differentiate us as a company focusing on wellness.
Let's talk a little bit about how Humana is responding in the area of technology. There are technology solutions that you're working on. What are they focused on?
Technology is really going to change aging, and I think it's going to change it obviously for the better. And I think technology is leading in this space. We're particularly focused on what we call the whole technology of aging in place. That's the application of sensors, and aging in place means how do we keep people in their home longer? Because once people leave their home, particularly in the healthcare system, it gets much more expensive, and it's generally something they don't want to do. So we look at the sensor technologies that are out there. Frankly, there's sensor technologies that you can place them very inexpensively in someone's apartment or house, community where they live, and it tracks their behavior. It tracks just their daily routines. It establishes a norm. This information feeds into algorithms, which basically say this is the way Paul behaves every day when he gets up. Once I leave that norm, there's alerts that are sent out, and generally those are correlated to some sort of health type issue. And then the caregivers that are looking after this data fundamentally are alerted, and then they can basically step in and say, how are you doing? Are you taking your meds? Are you feeling different in any way? They look at this behavior and they can come to some conclusions. It's also very good for family members too. They can also find out if I'm not, if some sort of thing is out of whack. So this is a very interesting technology, and it allows people to stay at home. We at Humana Cares, which is a company that we own that deals with the sickest of our sick, about 50,000 members. We're partnered with Intel to explore this with congestive heart failure patients, and that people that have been diagnosed with this. And the idea is the more information we get on them while they're living in the home, and some biometrical information in terms of and also in terms of activities of daily living, this information can be fed in. Personal algorithms can be established, and then when these folks get out of whack in one way or another, we can step in before it becomes a catastrophic issue and they have to be admitted to the emergency room and then into the hospital. We try to get in and nip that in the bud, and I think that's what a lot of this prevention is for. Technology can be very, very preventative. It can give caregivers much more information, and it can allow people to live at home. So we think it's a win all the way around.
So technology is a big part of the solution.
Yes.
But the solution is much broader than that. What else needs to be done in the service area, perhaps?
Well, I think in the service area, you basically have to have people be aware, have to know how to use the technology. They have to be willing to use the technology. So, for example, when there's nurses doing outreach, for example, home care nurses, a lot of them are used to getting in the car and going and making 4 to 6 calls a day. Now they'll be sitting in front of a computer screen or potentially a television or a camera like this, and they will be making 20 calls a day. They will be visiting people through their TVs or through their computers. That will make them much more efficient, and they will also be able to get a lot of that biometric information over a transom that comes through the television or the computer. So that'll be very different.
That is very different, but it's very much an integrated solution, both technology and service delivery,
Absolutely.
and applying new innovations.
Yeah, I think pure technology won't work, and pure service is going to be prohibitive because the supply isn't there, and also because it's going to be more and more expensive, and that'll be prohibitive in itself.
Well, Paul, we really appreciate you joining us today and appreciate all your comments. Thank
Great.
you very much.
Thanks so much, Russ.
Thank
Appreciate
you.
it.